Born and raised in Mongolia, this young woman came to New York for grad school. Far from home, she found herself struggling in ways she never expected.
I couldn't sleep or I couldn't eat much.
It's not easy for her to talk about this. She asks us not to show her face, and she opens up about her battle with mental health.
I realized I was going through a breakdown, and that was like middle of night. And luckily, school had a 24/7 service.
She said it all started with anxiety around succeeding. As an international student, she came with hopes of getting a job in the United States after graduation. She shares in her culture, asking for help is not common, especially as the oldest child expected to thrive.
In my culture, for example, as far as I know, even my parents or close friends, relatives, none of them, I don't think, go to therapy. When you go through a certain mental crisis, you would just wait until it recovers.
She's one of many young Asians struggling to balance cultural expectations with mental health needs. The Asian American Foundation put out a study. It said the Asian demographic struggles with mental health, with almost half scoring above the threshold for moderate depression. The Centers for Disease Control and Prevention said suicide is the leading cause of death among Asian American youth nationwide.
Here I'm at Apex for Youth in Manhattan, a nonprofit offering free culturally aware counseling to Asian youth. Here, therapy isn't just about treatment, it's about understanding culture and community.
The organization offers free mental health services for people as young as 5 and up to 24. Its goal is to make care both accessible and culturally safe.
Asian American youth have the lowest demonstrated support-seeking behavior in their demographic. And so there's a lot of barriers there just in terms of dealing with stigma, dealing with the ability to access culturally appropriate and linguistically appropriate services for them. We use mechanisms like storytelling, we do art therapy, we do play therapy, in addition to talk therapy.
APEC served more than 300 youth and families last year, and demand continues to grow as more students begin to see that asking for help isn't weakness, it's courage. Mizuki, Uchiyama, New York 1.